Hello everyone and welcome to the Radiology Gym. Don't forget, your brain is a muscle. If you don't use it, you'll lose it. So let's go to the gym and start practicing. I'm Dr. Ahmed Abdul Wahab and I'll be your coach for today. Stay with me. Hello everyone. Welcome to the Radiology Gym. Who's here today?
Sir, I wanna take a chance and do a practice session with you.
You're so welcome. So let's start. Let's not waste time.
Okay.
So this is a case of a 29-year-old female patient presented with vaginal bleeding. Her ultrasound exam was abnormal, so pelvic MRI was recommended and done for further evaluation.
Well, okay. First, let's start scrolling through these images. What do we have here? Oh, we have a sagittal or T2 weighted MRI image of the pelvis of this 29-year-old female patient who was presented with vaginal bleeding. And the MRI exam shows, the sagittal images show that there is some sort of lesion that is bulging from the fundal part of the endometrium into the uterine cavities. Of course, the uterus here is retroverted, and I think where there is this is the ovary, and as we can see, it's big. It contains multiple peripheral follicles. If you look at the other side, we can also see the same feature. It's a big ovary with multiple follicles, so probably this is just part of polycystic ovary syndrome.
Excellent job. So what do we do next?
I want to see the rest of the images. Let's go for coronal T2 weighted images. Okay, so these are the coronal T2 weighted images, and we can clearly see the bilateral polycystic ovary, and we can see that big endometrial lesion prolapsing from the fundal part of the endometrium into the uterine cavity, reaching almost to the level of the cervix, right around here. T2 fat-saturated images will be nice. Okay, so these are T2 fat-saturated images, and we can clearly see that this is the junctional zone, and here the junctional zone is not seen, and it's replaced by this lesion that is bulging from the fundal part of the endometrium into the uterine cavity, reaching almost to the level of the cervix right around here.
Excellent. So what else?
Probably T1 weighted images will be helpful to give us some more details.
Yeah, sure, why not?
So these are T1 non-fat saturated images, and we can see that the lesion that we discussed before, here it's iso-intense with no real hyperintensity, so probably there is only minimal hyperintensity here, which indicates blood as the patient complained of vaginal bleeding. So now I want to give contrast to see the pattern of enhancement of the lesion.
Wow, you're good.
No, thank you, sir. So, these are the axial, non-fat saturated post-contrast images, and we can see prominent vessels supplying the lesion within the endometrium. And if we go to fat-saturated T1 weighted images, like here, we can clearly see that the lesion is showing diffuse homogeneous post-contrast enhancement. Let's do T1 sagittal images. Post-contrast, yep, like it. Oh, this is beautifully demonstrated. The lesion is arising from the fundal part and it's going all the way to the endometrial cavity here. And it's homogeneously enhancing this whole thing, and it does not show any signs of invasion to the surrounding structures. I didn't see any signs of invasion or any malignant features. The fat planes, the pelvic fat planes, were clear, as we can see here in these T2-weighted fat saturated images. There is no real amount of free fluid in the pelvis. The bones are normal, so it's probably some sort of a benign hyperplastic endometrial polyp. However, the possibility of malignant lesion, although unlikely, they cannot be ruled out. So probably DNC will be helpful in this regard.
You're very good. Very nice approach, very good discussion. Keep coming to the gym and keep practicing, and you'll be even better.
Thank you, sir. See you later. Bye.
So this was our exercise for today. Don't forget to like, subscribe, share, and tell your friends about us. Keep supporting us. If you're looking for any private training sessions, send a message to the email in the description box and we will arrange something. See you later. Bye.